heading on down to Washington. Gonna see things going on, see if they've drained the swamp, and just got off the train here at Union Station. Old stomping grounds, beautiful building, real close to the Senate side, which is where I'm headed here for a couple more meetings. I'm walking under the Russell building over to the Hart building. Just saw Senator Rubio. He was on the phone looking pretty engaged with whoever he was talking to. Gonna head up to Senator Grassie's office and say hi to an old friend.
No, like Colin's over in Judiciary.
This is what lobbyists do. Hang out in the lobby. Senator Hart office building. The Watergate Hotel. Well, those stairs are in The Exorcist. Here in beautiful Georgetown University. Heading up to Baltimore, check out CMS.
Social Security?
Get into Social Security Administration.
Do you want to go by CMS?
Yeah, we should go see CMS.
That's the back, that's not the front though, you know that, right?
Oh, it is?
Yep, that's the back, the front.
This is the Social Security Administration, folks, where 15% of your taxes go every year, every paycheck. Another day, another protest of some sort. That's right, the Capitol, that's the Senate side. Right over there, the chamber is the House side. Got the Supreme Court. And welcome back. Just wanted to take a few minutes and talk about one of the big news items this week, which was a hearing the Senate Health, Education, Labor, and Pensions Committee received. The Secretary of HHS, Alex Azar, testified and had some really interesting comments on drugs, and I wanted to talk a couple of things that really caught our attention. We'll be doing a post on Health Reform Explained when I get back home, but he suggested eliminating pharmacy benefit managers, which is a big piece of the puzzle in the healthcare cost equation. Drug companies set what's called a list price, and then pharmacy benefit managers actually negotiate rebates. And the problem is those rebates rarely end up making it to the end user or the consumer of healthcare. They end up in a lot of different people's pockets. And he suggested maybe moving towards a more direct pricing system. He touted the Trump administration's drug plan outline, which was put out about a month ago, and also said some provocative comments about drug companies having to post the drug price in their ads, along with all their side effects and other things. So we'll have more on that in a second. I got to get to another meeting. There's the Supreme Court. If you can see closer, it says equal justice under the law. You should share in the comment section if you think we're living up to that principle. I think not. There's a senator. And stop.
most senior members of the Senate, Patrick Leahy of Vermont. My favorite general of all time.
And welcome back to Rolling with Sean McGuire and Edie Bellis here inside the Beltway. Wanted to take about a couple minutes here to run down the 5 stories of this week that are really catching my attention, and it's generating a lot of buzz here within Washington. Been here for a week, had a chance to meet with several people, attend some hearings, really get an understanding of what's going on. And here are the top 5 issues that we're dealing with right now in healthcare. Number 1 began about a month ago when the Trump administration unveiled their plan to lower prescription drug prices. One of the moves that they actually did and can do is allowing Part B drugs, Medicare Part B drugs, to be negotiated through the Part D program, which is an interesting move. Should help drive down some costs. I think they estimated it could be up to $20 billion. That would be over 10 years. But it also brought up the discussion of, should we let the Secretary of HHS negotiate for all drug prices? And this has been an issue that has been contentious on both sides. Democrats generally being in favor of that, Republicans not in favor of it. Secretary of HHS was up on the Hill at the Help Committee, the Senate Help Committee, saying that he does not see that happening under this administration. But there has been a lot of movement from them on addressing this issue of extremely high prescription drug costs. And we'll continue to see that. We talked about it a little bit earlier, some of the things that they're talking about. The other 2 areas deal with health insurance and employee benefits. Milliman, which is a well-known think tank, releases their annual report, been doing this for nearly 15 years, on the average price of a benchmark plan, which in this case they use a PPO plan for a family of 4, and they found that healthcare prices are going to go up by about $100 a month. Now, this isn't growing at as intense of a rate that it has in previous years. However, the overall number has gotten so big, so 6% of 10,000 is an awful lot more than, for example, 10% of 4,000. You get what I'm saying. I wasn't the best at math, but you kind of get an idea where I'm coming from there. Also, other states, due to the ACA, have released some of their numbers. New York in particular, we're looking at 25% rate increases up to that amount. And one of the things that they're blaming is the repeal of the individual mandate. And so that just goes to show you that things do change when we have different administrations. And the biggest news inside the Beltway this week was the fact that the Washington Capitals won the NHL championship. It was a complete mess down here with people, but it's nice to see the city come together. Also, be aware that they have not drained the swamp. It is very, very hot here this summer as well. And we will be checking in later when we return with any other news that has developed. But we appreciate you taking the time to watch Rollin' with me here on the Edie Bellis Network. All right, I got one more hearing, and then it's time for a drink, which, if you may or may not know, this town is a drinking town, and Roll Call released a story that was pretty interesting. I would check it out on the level of drinking by members of Congress and their staff, particularly during work hours. And when you read that, it may make a little bit more sense on why some of the legislation is passed and the thinking behind it, or lack thereof. Thanks again for watching. I got to get out of here. It's too much. See you next time.